My name's Georgina and this is Unit 32, Instructing Physical Activity, Assignment 1. Components of fitness. Body composition. A healthy related component of physical fitness that relates to the percentage of fat tissue and lean tissue in the body. Flexibility. This is the ability to move a joint through a full range of motion. Muscular endurance. The ability to perform repetitive contractions for a long period of time. Aerobic endurance, the ability to exercise non-stop for a long period of time without tiring. Strength, the maximal force you can apply against a specific weight. These are the physiological changes that happen in the body during exercise. 1. Hypertrophy. This is the enlargement of an organ or tissue from the increase in size of cells. Increased muscle tone. This is the continuous and the partial contraction of muscle. Decreased resting heart rate. This is when your heart is strong and is able to pump more blood. A strong heart needs to beat less times per minute than a weak heart that will have a high resting heart rate due to lack of fitness. Increased stroke volume. This is the amount of blood pumped by the left ventricle of the heart in one contraction. Then we have some lovely images. FIT principle. FIT stands for frequency, intensity, time, type. Frequency being how often you exercise, intensity how hard you exercise, time how long you exercise, type what kind of exercise you do. These all affect you when you exercise. For example, frequency. So if you're just new at training or new at doing an exercise, you're not going to go straight into exercising full-blown hours and hours. You're going to start gradually building your way up. Otherwise, you could seriously injure yourself. The same for intensity. If you're just starting out or you're not that fit, you don't want to start pushing yourself too hard and pushing yourself beyond your own limits and injuring yourself. Time, this depends on your body, or if you have, for example, breathing problems or something. You're not going to be exercising non-stop for a long period of time, because again, you'll just end up damaging your body. Type, this is what exercise you do. You don't want to rush into, so for example, I'm not going to rush straight into lifting heavy weights. I'd start off with smaller weights because I'm not that strong. And again, if you did do this, you'd end up injuring yourself. What is PARQ? PARQ is a physical activity readiness questionnaire. This is a self-screening tool to help you decide if you are ready to exercise safely. This is because some people push beyond their own limit and end up injuring themselves. Risk assessment. What is a risk assessment? A risk assessment is being able to find a hazard, a risk, and a control measure to prevent the risk from occurring. This is important to carry out a risk assessment for your own safety, so you know the hazard and risks of the exercise you are about to perform. By putting the control measure in place to help prevent injury, how can you minimise participant injury? Well, this links back again to risk assessment. That helps you minimise the risk of injury as you're putting them control measures in place, but also filling out a medical questionnaire and lifestyle form. This will help when it comes to planning an exercise program to make sure you don't push beyond your limits or doing the wrong exercise for you. Check the training environment. This is to make sure the environment matches the sport/exercise you'll be doing. Ensure the trainer is appropriately qualified. If you have a trainer that was not qualified and had no clue what they was doing, then you'll end up getting injured. This is because they would not know what control measures to put in place for your safety, or if they're training you beyond your limits. Conduct a full warm-up and cool-down. Warming up will reduce muscle soreness and help lessen the risk of injury. Cooling down allows for the gradual recovery of pre-exercise heart rate and blood pressure. What is the Exercise and Fitness Code of Ethics? I'm pretty sure I got this right. We'll see. Okay, right. Recognise that people should be treated as individuals, not condone or allow any form of discrimination, and promoting the rights of every individual to participate in exercise. Relationships. Develop a relationship with customers showing mutual trust and respect. Ensure the physical contact is appropriate and necessary and is carried out with a recommended guidelines and the participants' full consent and approval. Personal responsibility. To display high standards in the use of manners, punctuality, and the language you use. Demonstrate good behaviour and conduct yourself at all times. Professional standards. Set goals and work towards them at a high level and keep at a professional standard at all times. A warm-up is performed to make sure the heart, lungs, muscles and joints are prepared for the activity that follows. A warm-up could be specific to the sport or training session which is being performed or just general. Physiological changes. Temperature gradually rising will give time to increase stroke volume and cardiac output. Widening of the blood vessels within the muscles. You should warm up as well using movements that the participants will perform in their main session. A pulse raiser. At the end of the warm-up, the heart rate should be just below the rate that will be achieved through the main session. Pulse raiser should be gradually intensity as the time goes on. A pulse raiser usually lasts 5 minutes but can sometimes be 10 minutes. Joint mobility. Joint mobility is used to enable the joints to become lubricated by releasing more subliminal fluid and then warming it up. The joints that need to be mobilised are shoulders, elbows, spine, hips, knees and ankles. You can use some pulse raiser activities to also mobilise joints. For example, rowing will raise the pulse and mobilise all the joints. Dynamic stretching. Dynamic stretching is very important for the specific preparation of the muscles for the movements that are due to follow. The benefits of dynamic stretching are keep the HR raised, stretches muscles through range of movement they will use, and activates the nervous system. To perform dynamic stretches, you need to copy the movements in the session you will perform. Movements are repeated. Low battery. Okay. Are repeated in a steady and controlled fashion. Performing a set of 10 reps, you slowly speed up the movement as the set progresses. Cool down. A cool down is to help return the body to its pre-exercise state. The 4 main objectives: return the heart to normal, get rid of any waste product, return the muscle to the original pre-exercise length, and prevent venous pooling. Okay, that word, this is the factor that will prevent a person from exercising to make exercise unsafe. Common blood pressure higher than 160, so that's 100. Body fat higher than 30% for males and 40% for females. Diabetes, angina, joint conditions, and lung disorders. If you had someone who had just fainted or has just come from being ill, you wouldn't put them straight into exercise. You'd first go get them examined by GP, doctor, them people, before putting them straight into exercise, because this would be making it unsafe and putting their safety at risk. The end.